Good evening. At this time, I would like to welcome everyone to the November meeting of the Pitt County Board of Health. And at this time, I would like to call the meeting to order. We always allow time for public comment. Is there anyone in the audience at this time that has comments that we would need to hear? Okay. There being none, we have the agenda before us, and at this time, I would like to have a motion to approve the agenda.
So moved.
Second.
Thank you. All in favor?
Aye.
All right, thank you. Okay, the first item on our agenda is the highlight for the pit stop.
Yes. Just an update today for the pit stop. We had a request for proposals for renovations of the building in Bethel. Those closed, the RFP closed on October the 18th. We had 3 applications. One was selected and approved by the Board of County Commissioners last Monday. And Angie, what was the group that was awarded that? So they've got a $250,000 cap on the renovations. There's a renovation list and then a wish list of items, but that $250,000 cap. And then we've so far spent about $2,000 on remediation of that building and planning and design. So hopefully, since it's been awarded, we should start to see construction soon, and some with the goal of having an opening early next spring.
Thank you. And can you remind us what will be in that building?
Sure.
What will happen?
The Pit Stop Building's a project through ECU and Dr. Lamson, a partnership with the health department, and several partners, up to about 80 different partners are in the community. But the main, the bulk of that will be clinic space, to be shared clinical space for primary care, for satellite health department activities, for WIC, for social services, and basically a community space and a provider space.
Thank you. Thank you. Does anyone have any additional questions for Wes or Angie regarding pit stop? Okay, thank you so much for the update. The next item on the agenda is the communicable disease report, child health clinic with, I think Wes is going to give us that report.
Thank you. And this is a reminder that this is the communicable disease update, and this is for the year in review for 2023. So this is 2023, January 1st to the end of December, final numbers for communicable disease. I want to highlight communicable disease staff, and this is the first time we've fully staffed for coordinators since 2017. Lee Cutler is our Director of Nursing. Brittany Kinder is our Communicable Disease Supervisor. Kayla Manning is our Immunization Child Health Supervisor. Melissa Daggs is our STD Coordinator. Madison Lofton is our CD TB Coordinator. Valerie Tunnell is Immunization Coordinator. Alexis Brooks is our Disease Intervention Specialist for HIV and syphilis. And Alan Riggs is the Hepatitis Bridge Counselor. So the year in review, county cases, I'll start with syphilis. Congenital syphilis, 6 cases. Early non-primary, 45 cases. Late latent, 54. Primary cases, 19. And secondary cases, 32. STDs, chlamydia, 2,111 STD cases in 2023 in Pitt County. Gonorrhea, 938. HIV, 40. Non-gonococcal urethritis, 34. And PID, 17. Influenza, adult deaths. We had 1 adult death in 2023 from flu. 0 novel flu cases, no pediatric deaths in the year, Legionella 2, and then 3 TB cases for 2023. H. influenza 2, meningitis pneumococcal 1 case, and just to highlight, no cases of measles, mpox, mumps, pertussis, or tetanus in 2023, and then 1 case of varicella. Hepatitis, 0 cases of hepatitis A, 1 case of acute hepatitis B, 18 chronic carrier hepatitis B cases, 1 acute hepatitis C, and 386 chronic hepatitis C cases. Ehrlichiosis is one case. That's the tick-borne illness. Malaria, 2. Q fever, 1 case. 5 cases of spotted fever. And then tularemia, 1 case. And then I'd like to highlight just one investigation of last year. That was around October. That was the TB case in one of our schools. That involved coordination with school staff, letters to parents, individual letters to potential exposures, school and county press releases, and then we screened, there was 142 possible exposures and 2 rounds of screening and testing. Is there any questions about the 2023 CD report? All right. So if we can get the numbers earlier next year, we will like to do this probably closer to the answer. So we're wrapping up 2024 into December. Hopefully by our next televised meeting, we'll try to do the 2024 CD report closer to the end of the year. So it'll be fresh in our minds. But just to think about the last year, what we've seen that pertussis, whooping cough case. We've seen TB. We've seen different cases we want to highlight, going forward on that. So any questions about CD? And then I'll mention our child health clinic. I talked about it at our last Board of Health meeting. Very successful few days in the child health clinic to get kids back in school. We had 289 back-to-school immunization visits and 130 school health assessments, and that was a partnership with ECU and Dr. Simonson. And I thank Kayla Manning and all of our staff for organizing that. That was a huge amount of kids that came in to get their shots and to get their physicals so they won't be held back from school. All right. Thank you.
Thank you, Les. And I think the next item on the agenda, which is the community health needs assessment, we are going to delay that until the January meeting because it's not quite done yet. So we will be excited to hear, the results from this year's surveys. The next item on the agenda, we have the fee presentation. Angie Manning.
Apologize. I'm getting over a little crud. So we do have an addition to the fee schedule this evening. So this evening we're going to talk about the fee of Jynneos. This is the vaccine that, can you see that on your screen? Okay. This is the fee. This is the vaccine product that is used to treat the mpox infection. In April of this year, NCDHHS sent out the information that they would be no longer supplying this from governmental supply, and that local agencies were encouraged to place an appropriately sized order in April, and that they were expecting this to go to commercial supplies. We did have enough of a supply of our own, and it was in date actually through October to get us through while we were waiting for commercial suppliers to be able to assess pricing and everything like that. Jynneos is now commercially available and can be ordered through commercial suppliers. The vaccine is actually still available through the Vaccine for Children program, eligible 8 through 18 years old. The vaccine is now available. Commercial suppliers, the cost is actually ranging anywhere from $2,500 up into the almost $2,900 range per dose. The current reimbursement rate is anywhere from Medicaid is $284, Blue Cross and Blue Shield is $297. So we're recommending a fee currently right now for a vaccine of $299 per dose. And we need to add this to our fee schedule because it currently is not there. And they have actually just extended the expiration of the supply that we have received for the doses that we have. So we can continue to administer the doses that we currently have in stock. So we have not had to currently purchase any commercial doses as of yet.
And will that fee be $299 for the doses that we currently hold as
So
well?
the free doses we would not charge for. This would only be for when we have to start purchasing for commercial private doses that we would need to charge for. Yes, ma'am. But anyone who qualifies for the Vaccine for Children program would, of course, receive the free dose.
Okay. Thank you. Does anyone have any questions for Angie regarding the fee schedule update?
How long did they extend the expiration? Do you know?
Kayla?
Through August of 2026.
Oh,
We just found that out
2 years.
right as they were expiring, which is interesting.
Wow, okay. All
that's
right.
a long shelf.
Yes.
So we've got about 20 doses, so
Okay.
that should carry us for a good amount of time. We'll just be ready when, when those are
Yeah.
out.
Mhm.
Thank you.
And they're only sold in that 10 quantity bag.
They currently, right now, they are. So our main vendors that we order from right now are Cardinal and Henry, Shine, and of course we can order direct from the suppliers. But we are seeing McKesson is a new vendor that is getting very competitive with their pharmaceutical vaccine, and so we are reaching out. We also have a number of programs that are contacting us, trying to help local health departments to be more competitive with their vaccine pricing. But we have some other local health departments in surrounding areas that are enrolled in those programs. It also involves your billing with that. So we're kind of letting them give us feedback in those programs before we kind of jump into that.
Thank you.
Mhm.
Thank you.
But right now, we've only seen that you have to buy the quantity of 10. Yes.
All right. Any additional questions for Angie? Okay. At this time, we would need a motion,
Yes, ma'am.
okay, to approve the fee schedule adjustment for the Mpox vaccine.
So moved.
Second.
Yeah. All in favor?
Aye.
Okay, thank you. Motion
Okay.
passes. Okay, the debt set-off.
Yes, so this is actually a reoccurring annual activity that we are starting up again. We have been working with our ECU Health partners with Epic to actually get this workflow created to finalization and correct, to create the workflow for the annual bad debt write-off. We've had to overcome a couple of barriers. Two of those are we had to work to complete the workflow that had never actually been built with 100% completion with the criteria built out. Therefore, the account data could not be pulled. And two, we recently discovered that Epic had generated errors and placed some patient accounts in a hold status that went back as far as 2019. And patient statements actually were never generated. So we have been working diligently through some Epic issues. We've worked with ECU Health staff and completed the workflow build and have worked with them on patient statements. While we have some additional issues with patient accounts, we have resolved these issues that will allow us to move forward with the annual bad debt write-off, and we're working towards creating the file for the NC debt set-off as well. Now, that's a different process. The NC debt set-off is for accounts that have a balance of $50 or more and that are 365 days old for our policy. You actually could do it 90 days if you wanted to, but we would be 365 days. We are requesting the following. The write-off amount for us on the total of accounts is $2,649.93. The total amount of accounts is 120 individual accounts. The average account balance is $22.08. The maximum account balance is $49.44, and the minimum account balance is $3. The total years pulled for this debt write-off is 2019 to 2021. And again, the two criteria per our policy is the account has to be inactive for over 365 days. This means the client has not been to see the Pitt County Health Department within 365 days, and the account balance must be less than $50. The reason why we went up to 2021 is because we have some Epic issues that potentially affect accounts from 2022 forward. So we're working through those Epic issues.
Thank you. Does anyone have any questions for Angie regarding the debt set-off? Okay, no questions. You need action, right?
We do.
Okay, so at this time, if I could have a motion to approve the debt write-off, debt set-off?
So moved.
Second.
Okay, all in favor?
Aye.
Okay, any opposed? Okay, thank you. Thank you, Angie.
All right.
I think you stay there.
Okay, I was going to ask you his financial
You
report
stay
next.
right there.
Okay.
The financial report is next.
Okay. Is that up here? Let's see. I don't see that. Oh, here we go. Is that it? No, that's not it. Oh, no. Okay. Well, the viewers at home won't see it, but you have the financial report in front of you. The Excel sheet that you're all used to. So we are looking rather good for our revenues and finances. I'm very, very pleased. So your total revenues at the end of October are a total of $3,761,835. Your total expenses are $4,130,251. You do have a deficit of $306,000. However, your aid to county is submitted this week. You know, aid to county is always a month behind. Your aid to county number this month is $464,690,000.02. So you will be in the positive over $100,000 this month. So we continue to be well into the positive for the whole fund. Programmatically, you still have over $15 million in fund balance. All the programs are fairly healthy in their fee collection, their Medicaid collection. If you look, for example, in the private pay insurance, clinically, we brought in over $27,955 in commercial third-party payers, and currently we only accept 2 commercial insurances, Blue Cross Blue Shield and MedCost. We are currently working on that. We have executed a contract to contract with more commercial insurances. So we're excited about that. And so we definitely think that will be a large revenue generator for us. So we're keeping our expenses. So currently right now, 23% of our revenue has been collected, while we've only expended 21% of our budget. So we're still in a good place as far as we've taken in more revenue than what we've expended. And last meeting, we had an issue with United Healthcare and our Medicaid direct payments. I'm glad to say that we tracked down the missing money. We found out that United Healthcare mailed them to the wrong provider, and they cashed our check. So United Healthcare was kind enough to mail us another check for us. So we have received the $65,000 that we were back owed. We currently have an outstanding revenue of $20,000 that they still owe us, which hopefully we will receive in the next few weeks. But we have recouped that $65,000 in the missing 2 direct payments from United Healthcare. So all total, we are looking fairly well balanced for this part of the year.
It's wonderful. I have to ask this question.
Yes, ma'am.
Because on the BSEP line,
Yes.
there 3624 is red. Because it's not negative, it's just red.
Okay, so BSEP actually, we got a large refund from where we had paid a provider for services, and they refunded us and said no. They billed us incorrectly. We wrote the check, and they actually refunded us. And so we actually have to put the refund in the operational line. So that line has a large refund amount in it, and so their operating fund, they're operating in the negative at 3624 due to a refund. So,
Okay.
yeah. So they've got some operational expenses there that they still can go.
Okay, thank you for that.
Yep.
And also in that BSEP breast cancer line item, we see that other 2,000, that was
Yes.
a donation from the
We did.
ballet.
Yes, we did receive a $2,000 donation in October for the Greenville Civic Ballet of $2,000. And then Health Promotions gave a donation of $1,993 to Healthy Communities. So we did receive 2 donations there.
Thank you. Okay, does anyone have any additional questions regarding the financial report? Okay, yes.
Can I make one, just updates? We had our budget kickoff for the county last Friday. So And this year we'll be taking some information to the Board of Health in January and in February, because we have to submit a close to balanced budget to the county by the end of February. So we like to get at least as much as we can done by that February Board of Health meeting, just to give everybody here an update.
Okay,
Yep.
thank you.
Our budget will be due to the county by February 28th.
Okay. Thank you much. So do we need a motion on this one? No. Okay.
All right.
Thank you.
Thank you.
Yes. And next, we will have the Health Director's report from Wes.
All right. Does everybody see that on their screen?
Yes.
All right. Some respiratory virus surveillance update. You can see our big COVID wave has dwindled down end of July to October COVID wave, and we're starting to see a little bit of uptick in RSV and the influenza A. 13 inpatients in the EC Health system due to COVID as of today. Good news on the percentage positive, 3.1%. Last month in October, this time it was 9.5, and in September it was 23. So that just confirms we're seeing a big downturn in the positivity rate and in these COVID cases. We are seeing that little bit of pink line is increase in RSV, and then the rhinovirus and yellow, we're seeing some increases, and again that shortening of the COVID numbers. Just to be aware, we're still tracking to see when we're going to see the flu cases start to rise. So the big line to really look at is the red. You can see last year we had end of December was our spike, and so right now we're not seeing any spikes so far. So we want to continue to watch that to see when, if it starts in December, if it starts in January, like in a typical year. Lee's put together some clinic stats that I won't go over all of these, but I'll be sharing these monthly with everybody, just to show a daily clinic picture, all of the clinical services per day, and then kind of a show rate per day. So you get the number of total patients scheduled and the number of patients that come in. You can see some of our programs like family prenatals and others that are really high show rates, and you can see some of the lower show rate appointments, as in child immunizations, about 61%. So you can see for the different type of service, the different type of show rate we get. Clinic patients since July, you can see that steady increase. In the month of September, we had a huge increase because, like I mentioned earlier, we had the 289 immunization visits and 130 school health assessments, so a really high month in September. But that October still shows a upward trend since July. 839 patients came and were seen, and then we had 1,094 scheduled, so a 77% show rate for across all clinic services for October. STD clinic, you can see that gonorrhea, chlamydia, trick, syphilis, all those keep showing that downward trend since that little spike here in January. BV did show a pretty big spike this month, so in October, and then yeast continues to drop. H5N1, the bird flu, there were 6 new cases since our last meeting. 5 of those were in California. 9, all the new cases were exposure to dairy cows. So now we're adding California to that list. So Texas, Michigan, Colorado, California. So 5 total states were reported cases of bird flu. A new employees since the last meeting. October 17th, Dana Leggett is a medical lab tech. Passion Black is returning to the health department. She's office assistant 5 on coming back November 30th. And then Melanie Lowry begins. She's our advanced practice provider. Starts the 9th of December. We did have a resignation, Wendy Harrison from clinic. And then positions in process, public health nurse 2 for social work. That's been reopened. Public health nurse 3. Community health technician, WIC nutrition. 2 environmental health specialists. Actually, that'll be, 1 resignation as of today. So it will be 3. We'll be adding to that. Dentist. We do have exciting news on the dentist. We've interviewed an applicant. We've agreed on a hourly rate. We have made some adjustments to the contract that we brought to the board a few months ago that had included quarterly bonuses and a Medicaid cost settlement percentage. Since we're not getting any, see, even if we started dental in January, this will be 6 months potentially remaining in the year. Next fall, we'd go do the cost settlement update, and we'd actually get our check in spring of 2026. So he wouldn't be seeing that bonus until spring of 2026. We have, to make it more attractive, we've upped the hourly rate, and he's agreed to that rate. And so right now, we're working on the final draft of the contract to present to commissioners at their December meeting, and hopefully he can start 1st of January, the first of the year. Very, very excited about that. 2 dental assistants are working on a contract. We've had 1 hired, and 1 is in process of being hired. I wanted to mention some highlights. The influenza tour, that was 14 events. Our staff went around throughout the county, did our wellness team, and did doses, 325 total doses across those 14 events. So great job of the staff and getting out there and serving our divisions. Tomorrow is a diabetes block party. This is Diabetes Awareness Month in November, so we're having a block party at 201 Government Circle, the 13th. That's tomorrow from 10 to 12, if anybody has time to stop by. And then the one I mentioned too, sad news is that I mentioned to y'all a couple weeks ago, Christy Coulter passed away. She's our child health consultant on October 19th. And so we have some pictures of the staff with some T-shirts we had given out, and Amanda has some shirts for the Board of Health too to pass out to everybody here. But we're definitely going to miss Christy, and she worked with us right up until she went on hospice. So, I always showed up for her. And very sad to see her go. And then just want to thank you for all your support. Does anybody have any questions that I can answer?
I would just like going back to the visits kind of month to month, how they're trending up. I'd be interested to see in the next health report, kind of now that we're more fully staffed year to year, if we're seeing more patients now compared to the same month in 23 and 22 and 21.
Yeah, that could be great. Just and pull some historical numbers for the last full year to really show that difference. Yeah.
Yes, that would be very helpful because, we've been understaffed for so long. It would be great to see the difference there. Does anyone else have any additional questions for Wes? All right. Thank you, Wes, and thank you, the whole team, for all of your hard work.
Thank you.
Mm-hmm. All right. The next item on the agenda is the approval of the minutes from the October 8th meeting. You should have received all of those in your packets, I think last Friday, Thursday or Friday, and had a chance to review them. Are any changes or updates needed to those minutes? Okay. If not, we could have a motion to approve those minutes as written.
So moved.
All right.
Second.
All right, thank you. Any opposed? No? All in favor?
Aye.
Thank you. There being no more agenda items, I think we can have a motion to adjourn the meeting at this time.
So moved.
Second.
Thank you. Any opposed? All in favor? Yes, thank you, and thank you, everyone.